was the first time I seen a black man as a doctor, and he said that, you're going to be a doctor like me one day. I want to serve my community. I want less people to die. I want more people to be happy, and I want the world to be a better place. It's really difficult to become a doctor, and it's not necessarily about how smart you are, but it's about how dedicated you are, how hard you're willing to work.
Hi, my name is Gabby Grant. I'm here with Dr. Bernard Ashby, cardiologist, public policy leader, and Miami community leader. Dr. Ashby, what do your patients normally call you? Dr. Ashby, Bernard?
Well, my patients are a bit formal, so they love calling me Dr. Ashby, but my family calls me Dr. B.
That's understandable. What about your family? Where are they from?
So my parents are from the Caribbean.
Okay.
My dad is from Aruba, but that side of the family is actually Grenadian.
Yeah.
And my mom is from St. Kitts.
Beautiful.
But my parents met in St. Thomas, and that's basically my second home. So I am a true West Indian American boy.
Gotcha.
Yeah.
That's a beautiful story.
Yes.
What about growing up here in Miami? What was that like for you?
Man, my childhood was amazing.
Yeah.
And you know what? I didn't really appreciate growing up down here until I moved away. And I used to pray for like a white Christmas. But after living away and being cold and frozen, I like my Christmas lights on palm trees, okay? So that basically summarizes my childhood, especially being a Christmas baby. We're used to just being outside, getting in trouble. We used to live right across the street from Parkway Middle School.
Okay.
And I can tell you a couple of occasions where we got into a lot of trouble, but it was just innocent fun, hanging out, playing hide and go seek, maybe a little trespassing. But other than that, I had a great childhood with a lot of friends, a big family, and I wouldn't trade it for the world.
That's beautiful. Growing up here, as far as you being a cardiologist, what inspired you to do that? Or was there someone specific in your life?
Well, let me start with my mom.
Okay.
I could say she inspired me, but she brainwashed me a little bit. And I could tell you a couple of stories, and I didn't realize it until I had my son, and I saw her interactions with him.
Yeah.
And so I distinctly recall that I was obsessed with cars. I used to love fast cars. I used to love Lamborghinis and Ferraris. And every once in a while, we would go for a family dinner in South Beach. And there was a car dealership that we would pass. And my brothers and I would always point to the car and be like, that's my car. And my mom would always say, yes, you'll get that when you become a doctor. And so I think that's where the doctor thing came from.
Yeah.
But beyond that, she was just a hard worker, very dedicated to her craft, really was passionate about her care for patients, which obviously inspired me. And it was through her that I met my first mentors. The first I recall is Dr. Martin, which was a friend of hers who's from St. Kitts. And it was the first time I seen a black man as a doctor. And he took a lot of time to talk to me and really empower me by pouring into me. And he said that, you're going to be a doctor like me one day. And I believed it. And then beyond that, her other friend, which she met through her job, Dr. Rutherford, who was a pediatric pulmonologist, she definitely did a lot for me in terms of just giving me some bread and butter, brick and mortar advice on how to become a doctor. And I would forever be indebted to them. But it's really the entire village. I mean, between my mom, her friends, and my family, and the neighbors, it was really a community of inspiration.
It definitely takes a village to raise such a prominent doctor.
Amen to that. Amen to that.
Did you always want to do cardiology?
No.
Is there a story behind that? Okay.
No, that's a great question, because initially going into it, I wanted to be a pediatric pulmonologist. Why? Well, because Dr. Rutherford was one, but also I had really bad asthma. And I used to, get treatments. I used to be in a hospital on occasion. I actually ended up in ICU at one point. And so I looked up to the doctors that saved me basically, and wanted to be like them. And furthermore, my mom was a respiratory therapist, so dealing with the lungs seemed like something I wanted to do until I got to medical school, and I was like, I don't want to do lungs, and I want to take care of kids.
Yeah.
No offense to the children out there, but I chose to do internal medicine and then eventually become a cardiologist.
Okay.
And in terms of why I decided to do cardiology, it was actually through some research that I was doing on aneurysms that kind of opened the door for me to get into cardiology, and so far I love it.
That's beautiful.
Yeah.
That's a beautiful story.
And one last thing, and so I almost forgot. So that's what opened the door, okay? But once you learn about cardiology and heart disease, you quickly realize how important it is. It is the #1 cause of death in America, particularly with Black Americans, and it's largely preventable. A lot of folks don't know that 80% of premature cardiovascular deaths are preventable. That's why I'm big on screening, and that's why I love what I do, because I feel like I'm genuinely saving lives.
Yeah, that's beautiful. Dr. Ashby, being a doctor is obviously a challenging feat. What kept you motivated? What inspired you to keep going?
Man, just pure passion. Meaning that, when I was studying late at night, 2 o'clock in the morning, getting ready for a quiz or exam, the next day, or the same day actually, at like 8 a.m., I would remind myself about what my potential, my future impact is going to be. And so for me, like, not just learning the art and the science of medicine were important, it was also learning the why. And becoming a physician is more than just a job. It's actually a calling. And I always reminded myself of that when, it was cold, freezing, and I was tired. It got me through a lot of tough days.
Okay. What was your why?
My why was, I want to serve my community.
Yeah.
I want less people to die. I want more people to be happy, and I want the world to be a better place.
That's a beautiful answer.
Thanks.
As far as you being a Black man in medicine, that's obviously also another feat stacked on top of that. So what were some of the challenging things that you might have faced coming through?
Yeah, that's a deep question.
Yeah.
And so there's a lot of my colleagues who dealt with something called imposter syndrome. And I am anti-imposter syndrome because my family really poured into me. So I was ultra confident going into healthcare and going into medical school. And I never doubted myself for a minute. And sometimes people would say things, or I would run into issues. But in hindsight, what I realized was I was operating an institution that was foreign to me. And so a lot of the conflicts that I had were because I was within a healthcare system that I had never experienced before, even though I grew up around my mom and my my mentors, who basically told me about the art of medicine. But operating inside of the healthcare system was really a learning experience that I had to adjust to. Being a Florida kid, coming from public schools, I was never taught about a lot of the formalities that exist in healthcare. And so learning healthcare is actually like learning a new language and learning a new culture. And once I learned it, I began to thrive in terms of doing well academically. But what I realized is that a lot of our patients run into those same issues, meaning that they're going to these healthcare systems that were not designed for them. And as a result, they run into a lot of issues where they don't feel like they're served. And that's generally because it's not designed to actually serve them. It's more one size fits all. And I'm a very big proponent on Black folks in particular having healthcare systems that serve us and empower us.
Right. There's obviously an unequal access that you talked about as far as barriers with people that look like us. So as far as motivating the next generation, how do you integrate that within your practice and your work?
Yeah, so I mentioned earlier that meeting Dr. Martin was a profound experience for me. And I always try to create opportunities for me to interact with the future. and realizing that just seeing me in my position is inspiring to a lot of the youth.
Exactly.
But also I make myself available and try to interact with them over a long period of time, because it's really difficult to become a doctor. And it's not necessarily about how smart you are, but it's about how dedicated you are, how hard you're willing to work. But also, there's a lot of fundamental skill sets that are not taught to us, even in the education system, where if you don't have it, you're going to run into issues even though you're putting in that work. And so it's important for me to mentor. It's important for me to be visible and to let people know that I'm just like you. I'm a regular kid from Florida that had his ups and downs, but decided that I wanted to be someone that would be a leader in my community and serve my community. And if I can do it, so can you. But also it takes mentorship.
Absolutely. Like you said, it takes that village.
Yeah.
If you could say anything to the future generation of medicine, what would you say?
I would say that don't let anybody tell you that you are not worthy of becoming a leader in healthcare. Don't let anybody tell you that you're not smart enough, you're not polished enough to become exactly what you want to be. And you're going to get a lot of those messages explicitly and implicitly, but it's up to you to really believe in yourself, and also lean into your community, lean into your village, and let them support you, because it is a tough journey.
Absolutely.
But you'll get there if you stay focused and actually believe in yourself.
Absolutely. As far as your day-to-day, what does that look like for you?
Well, my days are a little hectic, but I'm able to maintain it because of a good schedule. So I do have a child, and I try to get up early so I could do a quick workout and then get him ready for school. And once I drop him off, it depends on if I'm in clinic or if I'm at the university, because I also teach. Education is very important to me. And so I'm very proud of my role at Larkin University as the medical director. And so on those days, I will go to the university, usually be involved in a series of meetings. And then once classes start, then I'll be involved in teaching certain courses like cardiology and health policy as well. But a lot of my days are a mix of, I guess, teaching, learning in terms of being prepared for the curriculum, and actually doing curriculum development as well. So it's a lot of tedious work, but I do enjoy it. And in terms of my clinic, I do a lot of telemedicine as well. So that allows me to extend myself, meaning that I can be available to my patients really at any point, even when I'm at the university, because technology has allowed me to really connect with my patients where they're at, as opposed to having them take the entire day off and come to the office. But on the clinic days, I do enjoy those because I like to, interact with my patients.
Exactly.
And I have a couple of patients that treat me well, so they bring me food. So if you're a patient of mine, I like stewed chicken. Okay. But those days are generally just, I'm just in clinic seeing patients and interacting with staff, but also interacting with students. So we have an internship program. A lot of students shadow us, and I get a chance to interact with them. And then, there's other days where I'm doing diagnostics and procedures as well. So I might spend a half a day there and get that work done. And then in the evenings, again, I'm probably with my child, but I do enjoy to learn. So I'm a podcastaholic. And so I probably listen to a lot of history and politics and geopolitics podcasts, in addition to learning about healthcare, because being a physician means that you're always learning. And so I do enjoy learning about new research and new breakthroughs in the field of cardiovascular medicine, but in medicine in general.
Yeah, absolutely. Being a physician is definitely a lifelong learner. That's a really busy schedule. Like, how are you able to manage all of that?
Well, That's a great question. Sometimes I don't know how I do it myself,
Yeah.
but I'll be honest, is that it comes down to being dedicated and passionate about, what you're doing, what your purpose is. And so,
Exactly.
like I mentioned earlier, when I was studying 2 o'clock in the morning, getting through those dark days, even on a good day, even when I'm busy, I'm doing what I love to do.
Yeah.
And so the thrill is there, and it's actually, for me, doesn't feel like work half the time, meaning that, being in an environment where I get to teach, I get to heal, I get to listen, I get to be there for my patients and just, folks in general. It's an environment that I thrive in. So even though it seems busy, it doesn't feel like work most of the time.
And that's so beautiful to have a career that's so
Yes.
rewarding to you. So
Yes.
yeah. We were talking about your patients and just your journey so far as a physician. What are some of the challenges that you faced as far as reaching your patients, or what are some of the challenges that they faced?
Well, one of the main challenges that I find with my patients and just folks in the community is that access is an issue.
Okay.
And I'm surprised by how many patients don't know that there's the options on the table for them to get low cost or even cheap healthcare, meaning that they don't have to pay a whole lot. There was legislation passed years ago that actually provided subsidies for those in the community that they don't know about. And if they just called and checked out some of the options that are available to them, they'll be surprised by how many insurance plans that they qualify for. So I always try to encourage my patients to, check with the experts, learn what your options are, and, get access, because that is the first step to taking care of yourself.
As a healthcare provider, what difference does that make when your patients do have that information?
Well, it's important for me because that's how we are able to see them.
Yeah.
Because a lot of patients, unfortunately, either have insurance plans that I don't take, or they have insurance plans that are frankly inadequate, meaning that they don't provide a whole lot in terms of comprehensive services. So I always encourage them to look and find out what their options are so they get the full support, meaning that you want a plan that covers your visits, but also covers your medications if and when you need them. Also, you want to be sure that if something bad happens to you, you end up in the hospital, that you're adequately covered. So I find that my patients that are insured and informed, they tend to come and see me more because they're not worried about surprise billing. But beyond that, I'm always an advocate of just informing the public. I think education is very important. And with education comes empowerment, and information is power. So whether it be navigating the insurance system, navigating the healthcare system, or just being generally informed about conditions that can impact you, but also how to prevent them is I think, a worthy of my time, because again, education is power.
Absolutely. Preventative medicine is probably the most important thing as a
Yes.
doctor. Absolutely.
Yes. So I just wanted to talk a little bit more about prevention. So in my practice, what I tell my patients is that we are basically your consultants, meaning that we don't tell you what to do, okay?
Yeah.
We are part of your team, and in terms of prevention, early screening is important. So getting tests done to, for example, look inside your arteries to make sure that you don't have plaque can go a long way in preventing a heart attack or stroke. And more information empowers you to make better decisions. And so that's what we spend a lot of our time doing in clinic. But beyond that, moving your body is extremely important. So the American College of Cardiology and American Heart Association recommends at least 50 minutes of exercise a day. I like to say 30 minutes, more or less, 3 days a week. But that movement of your body decreases risk of heart attack, stroke, but decreases your risk of stress, and actually improves your life expectancy just walking, particularly walking outside, getting some good sun, fresh air. That is what we need as humans to thrive. And unfortunately, because of the work schedule, the 9 to 5, we spend a lot of times indoors, sitting at our desks, not moving. to always encourage my patients and anyone in the community just to move your body. Then in terms of diet, it's not that complicated. The ACC/AHA recommends a Mediterranean diet as a form of a heart healthy diet. But I would like to take it a step further and just say that, you want to just keep it simple, meaning that you want to get 2 servings of fruits, 2 servings of vegetables. You want to avoid preserved or processed foods, and natural is better. So eating more fresh meats, okay? But also fresh fruits and fresh vegetables, as opposed to getting those chips and fries and fried foods, will go a long way in improving your health. So I think it's always important just to get back to the basics when it comes down to prevention. Move your body and eat well, and a lot of things will go well for you.
Absolutely. That was beautiful.
Thanks.
It was really nice having you
Thank
here
you.
today. Well, now you know. Click our subscribe button and our notification bell to find out more. Bye.